Hey everyone, Dr. Mike here. I'm excited to talk to you today about a very important topic that affects many men around the world. Today we're diving into a crucial topic for men's health PSA tests. PSA stands for prostate-specific antigen, and this test measures the level of PSA in a man's blood. It's a key tool in screening for prostate cancer, which is one of the most common cancers among men. The PSA test is a blood test that helps screen for prostate cancer. When PSA levels are elevated, it can be an indication of prostate cancer, but it's not always that straightforward. It's valuable, but not perfect. Elevated PSA levels can be caused by a variety of factors, not just cancer. For instance, an infection or inflammation of the prostate can also raise PSA levels. Several factors can cause a temporary spike in PSA levels, even without cancer. This can lead to false positives, where the test suggests cancer when there isn't any. These false positives can lead to unnecessary biopsies and anxiety. It's important to understand what can affect PSA levels so that we can make informed decisions about our health. In this video, I'll break down the top 10 reasons for misleading PSA results. We'll explore how different conditions and activities can impact your PSA levels. Let's get started. Let's kick things off with recent ejaculation. It's a topic that might make some people a bit uncomfortable, but it's important to understand how it can affect your PSA levels. Semen contains PSA, which stands for prostate-specific antigen. After ejaculation, the levels of PSA in your blood can be elevated. This is because the prostate releases more PSA during ejaculation, which then enters the bloodstream. This elevation in PSA levels usually happens within 24 to 48 hours after ejaculation. So, if you have a PSA test scheduled, it's crucial to keep this time frame in mind. While the spike in PSA levels isn't massive, it can be significant enough to push your numbers higher than they would be otherwise. This could potentially lead to a false alarm or unnecessary concern. To get the most accurate reading from your PSA test, it's recommended to abstain from sexual activity for at least a couple of days before the test. This helps ensure that your PSA levels are at their baseline. Your doctor will thank you for it, and you'll have less to worry about when you get your results. It's a simple step that can make a big difference in the accuracy of your test. Trust me on this one. Taking these precautions can help you avoid unnecessary stress and ensure that your health is accurately monitored. Next up, prostate infections or prostatitis. Prostatitis is an inflammation of the prostate gland which can be caused by bacterial infections or other factors. It can affect men of all ages but is more common in men over 50. Symptoms can vary widely from mild discomfort to severe pain and can include difficulty urinating, pelvic pain, and flu-like symptoms. These infections can be painful and elevate your PSA levels. PSA, or prostate-specific antigen, is a protein produced by both normal and malignant cells of the prostate gland. When the prostate is inflamed, it releases more PSA into the bloodstream, which can be detected through a blood test. Inflammation from prostatitis triggers more PSA release into your bloodstream. This can sometimes lead to confusion with prostate cancer, as both conditions can cause elevated PSA levels. However, prostatitis is not cancer, and the two conditions are treated differently. The degree of elevation varies with the severity of the infection. A higher PSA level often indicates a more severe infection, which may require more intensive treatment, such as antibiotics or other medications. A mild case might cause a slight bump, which can often be managed with over-the-counter pain relievers and increased fluid intake, while a serious infection could lead to a significant spike. In such cases, more aggressive treatment may be necessary, and it's important to follow your healthcare provider's recommendations closely. This increase is usually temporary. Once the infection is treated and clears up, PSA levels should normalize. It's crucial to complete the full course of any prescribed medication to ensure the infection is fully eradicated. Once the infection clears, PSA levels should normalize. Regular follow-ups with your healthcare provider can help monitor your recovery and ensure that your PSA levels return to normal. Keep this in mind if you're dealing with prostatitis. Early detection and proper treatment are key to managing this condition effectively and preventing complications. Always consult with your healthcare provider if you experience any symptoms or have concerns about your prostate health. Let's talk about medications. Some common meds can interfere with PSA test results. Certain drugs can lower or raise PSA levels. This can mask potential problems or cause unnecessary worry. Always be upfront with your doctor about any medications you're taking. This helps them interpret your PSA results accurately. Now, let's talk about urinary tract infections, or UTIs. UTIs can cause inflammation in your bladder and prostate, leading to higher PSA levels. This spike is usually temporary. Once the infection is treated, PSA levels should return to normal. Remember, guys can get UTIs too, even though they're more common in women. Keep this in mind if you're dealing with a UTI. Let's talk about recent prostate surgery. Any procedures on your prostate will cause temporary inflammation. This can elevate your PSA levels during the healing process. The time it takes for PSA to return to baseline varies with the type of procedure and individual healing. Open conversations with your doctor about your surgical history are crucial. This helps them interpret your PSA results accurately. Now let's discuss benign prostatic hyperplasia, or BPH. BPH is simply an enlarged prostate, common as men age. An enlarged prostate can produce more PSA even if it's healthy. This doesn't mean you have cancer, but your doctor will need to factor in your BPH. Keep this in mind when discussing PSA results with your doctor. Let's talk about exercise. Strenuous exercise like long-distance running or intense weightlifting can temporarily increase PSA levels. This spike is usually short-lived. Levels should return to normal within a day or two. To be safe, avoid intense exercise for at least 24 hours before your PSA test. This ensures a more accurate reading. As we get older, our bodies change, including our prostate. An aging prostate naturally produces more PSA. Men over 50 are more likely to have higher PSA levels, even with a healthy prostate. Discuss your PSA levels in the context of your age and overall health with your doctor. This helps in accurate interpretation. Let's talk about prostate biopsies. A biopsy involves taking tissue samples, causing inflammation and a temporary rise in PSA. This increase is usually fleeting. Levels should return to baseline as your prostate heals. It can take several weeks or even months for PSA to fully stabilize after a biopsy. Keep this in mind if you've recently had a biopsy. Last but not least, let's talk about inflammation. Inflammation is your body's natural response to injury or infection. Inflammation in your prostate can temporarily elevate PSA levels. This can make it tricky to interpret test results. Inflammation can be caused by infections, UTIs, and recent procedures. So there you have it, the top 10 reasons your PSA test might be misleading. We've covered a lot, from everyday activities to medical conditions. PSA tests are valuable but not perfect. Many factors can influence PSA levels. A high PSA doesn't always mean cancer. If you have concerns, reach out to your doctor for accurate information and advice. Thanks for watching. Don't forget to subscribe for more on men's health.